And the first question was, what was your first experience with mental illness and schizophrenia?
When I first was introduced to the whole notion of severe mental illness, or dementia precox, as it was called in those days, the individuals who had this particular disorder were considered as something apart from the rest of humanity. They were considered lunatics, crazy, insane. And the belief was that these individuals were insane through and through, that there was nothing normal you could get a hold of. I remember there was one of my colleagues was accused of molesting a couple of his schizophrenic women patients, and the charges against him were dismissed totally because the patients were insane and therefore they weren't capable of making a competent judgment. Well, when I went to medical school, the professor who had trained under Franklin said there were two types of mental disorder. One was dementia precox, and the other was psychopathic personality, and neither were treatable. So consequently, I had no interest at all in psychiatry, and I took a residency in pathology, and then I decided on a career in neurology. After 2.5 years of neurology, it was determined that all neurology residents had to get at least 6 months of psychiatry. The reason for this was that they were short of psychiatric residents at that time. So though I kind of fought this, I had to comply. And so my first personal introduction to mental illness was when I was going on one of these services, on the psychiatric service in a VA. And the first room that I went into was filled with people lying in bed, and they were yellow. And they were also convulsing. And I said, what is this? And they say, well, these are patients with general paresis, and they're getting the malaria treatment. The next room was filled with people who were in coma, and they were getting insulin shock. The next room was filled with people who, some of whom were convulsing and some not, and they were getting metrazole shock treatment. Finally, I was taken to the hot tubs, and there the patients who were aggressive or unruly were put in these tubs, and they had canvas. They had a canvas layer over them with just their head sticking out. And every once in a while, the patient would get under the canvas topping and, of course, would die. So I was then told that part of my job was going to be to do group therapy with these patients. And so I started my first group therapy session, and I think we had about 8 or 10 patients there with severe mental illness. And several of the patients were falling asleep. Several were walking around the room, a few were mumbling, and others were just talking to themselves. And I tried hard to connect with them, but I didn't know how. I thought there must be some way I could do something like psychotherapy, but I was unsuccessful. I would be so exhausted, Julia, after one of these sessions that I had to go back to my room and sleep for about an hour. So I'm saying this by way of indicating how far the field has gone. And I'm so pleased that there are so many people who are interested in psychotherapy of mental illness.